Okay, so it's Maggie. I did my injury project on a UCL tear. UCL is your ulnar collateral ligament, and I did it in the elbow. So it's located on the medial side of your elbow. The point of attachments are one side of the humerus and the other side of the ulna. It has 3 bands or divisions: the anterior, posterior, and transverse, which you can kind of see in this picture up here. And the anterior is considered the most important for your elbow stability. What is a UCL tear? It's basically just a tear and injury to one of the ligaments on the medial side of your elbow. It can be injured in many different ways, commonly from overuse or repetitive stress on the ligaments. It's especially common in athletes that play sports requiring overhead throwing. The most common sport we see it in is baseball, but it's also seen in javelin, football, tennis, softball. Anything with that motion could injure the UCL. It can also be injured if you fall or overstretch your arm. That can cause the UCL to rupture or get pulled off the humerus, chipping from a small piece of bone. My teammate actually did that this fall, and the physical therapy has not been fun for her. Symptoms of a UCL tear would be like a sudden pop or pain on the inside of the elbow, leading to the inability for you to continue throwing. Pain when accelerating the arm forward just prior to releasing the ball is another symptom. Tingling or numbness in the pinky and ring fingers. In some cases, you'll have swelling and bruising, or in baseball, slower or less accurate pitches. So when diagnosing a UCL tear or overstretch, the most common test used is a valgus stress test, and that's when the shoulder is abducted and externally rotated while the elbow is ranged from maximal flexion to 20 degrees flexion as a valgus force is applied. So a patient with valgus instability will experience medial elbow pain or apprehension in the 70th through 120 degree flexion range. And over here you can kind of see how the valgus stress test is done through a picture. Right here is a YouTube video if you want to watch how the valgus test is done. You can also see a UCL overstretch or tear in an MRI or an X-ray. So the degree of injury, after it's torn, it most likely isn't going to heal on its own, but there is 3 different sprain grades when it comes to a UCL. So the first degree is it's painful, but the ligament's not lengthened, it'll heal over time. Second degree, the ligament still works, but it's stretched. Most likely you're not going to need surgery, just some physical therapy and a lot of icing and meds and stuff. Third degree, the ligament has torn completely and it doesn't have function. So that's when you're going to need the surgery. Treatments for UCL injury they can range from rest to physical therapy to surgery. Kind of just depends on the extent of the injury and your health goals. So non-surgical treatments would be rest, aspirin, ibuprofen, icing daily until the swelling and pain is gone, or physical therapy to strengthen the muscles around the elbow after the inflammation has decreased though. Like you don't want to start that while your elbow's still swollen. Over here are some rehab exercises that are commonly used. And the surgical treatments is Tommy John surgery. So Tommy John's is mostly performed on players who perform at a high level and desire full throwing abilities. So it's usually pro baseball players, college baseball players, or just kind of anybody in the college or pro leagues. Usually it requires a UCL total replacement. So the doctors take the tendon from somewhere else in the body or from a donor's body and have it act as a new UCL. The grafts are usually taken from the hamstring tendon or the tendon of the forearm or the big toe extensor tendon. And you can kind of see how it's done in here and how it's threaded. Basically, they make an incision 3 to 4 inches long on your elbow, and they move through tissue and muscles to get to the damage, and then insert the new tendon by drilling holes in the humerus and ulna. And yeah. So a recovery for a UCL injury without surgery, it's several weeks to several months, kind of depending on the range of motion that you want to achieve. With surgery, so with Tommy John's, it's going to be 9 months to a year, possibly longer. The elbow is going to be placed in a hinge brace like this, and you'll be able to gradually increase your range of motion until you can fully extend your elbow. And you'll also be going through some pretty hefty physical therapy. So the phases of recovery for a torn UCL or after Tommy John surgery, phase 1, it's going to be immediately after surgery to 3 weeks. Your movement's going to be restricted, and by week 2, you can kind of gently move your elbow. Phase 2 is going to be weeks 4 through 8. You're going to be building strength starting with a 1 pound weight, and you kind of increase by 1 pound each week. You should fully be able to extend your elbow by the end of week 8. Phase 3, weeks 9 through 13, you really kind of aim for a broader range of motion, more flexibility, and by week 12, you'll be doing intensive muscular exercise programs. So you'll also be able to emphasize proper throwing mechanics by these weeks. And phase 4, weeks 14 through 24, you'll be throwing again, starting at 45 feet through long toss. You'll be able to stimulate gameplay and start to get back to normal. Basically, it'll be 10 to 18 months before you're throwing in a game again. So results of Tommy John surgery, this is kind of what it looks like over here. And since it's very common in baseball players, a lot of baseball players have this same tattoo. They get their scar turned into baseball stitches. So some prevention tips for a UCL injury would be don't throw sidearm, keep your arm in the scapular plane, maintain your shoulder range of motion, strengthen your core, use arm care programs. My softball team presses us to do this. They always enforce this on us. And don't throw with pain or inflammation. And here are my sources.